Like many rural Wisconsin kids, Bruce Kraus had humble beginnings. His parents taught him and his 4 siblings the importance of hard work, living by the principles taught in Scripture, and of course, education. Bruce's intellectual curiosity was nurtured by his family and in the one-room schoolhouse he attended not far from the family farm. When Bruce was older, he transferred to Clinton High School. During his 2 years as class president, he wrestled, joined the football team, played first chair clarinet, and attended Badger Boys State. When Bruce graduated, his classmates voted him most likely to succeed.
Growing up in rural Wisconsin, for the most part, it was college, Copenhagen, and country music, so to speak. I first met Bruce when we were about 14 years old. I thought that he had all the brains, and that was why I didn't have any brains, which many of us envied because our mothers wanted us to get as good a grades as he got, I think. And most of us were kind of just crazy with our goals at that age. But his ability in the locker room during football, he had a very calming influence. He had a very positive influence. He was always encouraging to us starters. And when he got his opportunity to play, he gave it 110%.
Bruce was fascinated by medicine and desired to become a vet. He was accepted into veterinary school, but unfortunately for the Dairy State's livestock, he decided to change course in college to become a physician. He wanted to help people. Bruce knew he had to work his way through school, and like many responsible young people, did what he had to do to earn money. He worked hard building silos for local farms, keeping order as an RA in the dorms, and even as a door-to-door salesman selling cookware for women's hope chests. When he started medical school at the UW-Madison, his helpful disposition led him to his future wife, Pam, on her move-in day.
2,300 miles in my '68 Mustang, and I arrived at the apartment, 3rd story up, no elevator. We're carrying boxes. Who shows up but Terry, our next door neighbor, to offer help. And he indicated that indeed he had a roommate, Bruce Kraus, who, if he went and asked, could also offer help. So that's how I met Bruce. He was a challenge. He was very shy, very quiet, and terribly bookish. He was from a family farm, which was intriguing to me. I'm from San Francisco Bay Area, and so we were polar opposites. I decided to pull the fun out of him and get to know him better. So one of our first dates was actually a tour of the med school for me. It was interesting, especially that anatomy lab. But it's what he knew best at the time. So I decided to broaden his horizons. And then after that was the $2.50 fish fry.
After Pam graduated from grad school and began teaching, she and Bruce were married. Bruce finished medical school, and the two decided to move to California, where Bruce completed his residency. After several years, Bruce became the chief medical resident at San Joaquin General Hospital while working evenings in the ER. Pam worked as a teacher while they started a family. Just before the birth of their first child, he decided to make her a special gift.
He decided that he would be a woodworker. I'm not sure if he had 4-H projects behind him or not, but he decided he would build our firstborn a cradle. He really didn't have a lot of extra time. As an intern, he was very busy. And he didn't really have a workshop, so I'm not sure how he did this. And he was, I think, staining it and finishing it up when I was in the hospital with her.
Their first child, Rachel, was born in 1975, followed by Nathan a few years later, and then me, Aaron, their only Wisconsin baby. Bruce always loved rural Wisconsin, and when Columbus Community Hospital recruited him to open his own practice, he took it. When Bruce arrived, the new hospital was still a hole in the ground. 6 months later, and under 3 feet of snow, he assisted in the strenuous task of helping move patients to the new hospital.
It was crazy. We got to the hospital, we knew we were gonna take patients out, and there was such a blizzard you couldn't even see to drive. The snow was heavy. We didn't know how we were gonna get staff in, so people were sent out on snowmobiles to pick people up to bring them in to help. I have never seen Dr. Kraus rattled. He's always stayed very calm, no matter what the situation. That's why he was always very good in the ER urgent care, because he always stays calm.
As a young family, just out of residency, Pam and Bruce didn't have much money to start a practice. So Bruce worked days in the clinic and nights in 4 different hospital ERs to save up. The work ethic he learned growing up on the farm was second to none.
He'd work in the evenings down in the emergency room, and he was always good to work with. Friendly, listened to the patients, always very kind and compassionate. Dr. Kraus is a very business-like person. He would bring his computer and go around, see his patients, put stuff in the computer for him. And that was the first I've ever seen a doctor have a computer at the hospital.
Dr. Kraus was constantly finding ways to grow and innovate. Whether it was introducing computers into his daily healthcare practice, finding new ways to care for his patients, or exploring alternative avenues of care. Bruce's thirst for innovation has led to groundbreaking developments in Wisconsin medicine. He developed Cornucopia, the first occupational health and wellness program of its kind in the state. In the late 70s, nurse practitioners were not providers many people were familiar with. In fact, this new form of provider was met with opposition and resistance by many physicians. As he was getting his own practice off the ground, his love for teaching others brought him his first nurse practitioner, Sandy.
I taught at the university in nursing and decided that I wanted to be a nurse practitioner. I would need a physician to work with, and so I asked him if he would consider me as a student with him, and yeah, he said yes. He was always willing to try new things. After I finished and he hired me, then we also brought in nurse practitioner students, and he and I precepted the students together. He was not only a teacher for his patients, but he was also a teacher to those around him. Soon after I became a nurse practitioner, there was a movement down in Madison for nurse practitioners to gain prescriptive privileges. He and I both went down and we both spoke at the Capitol. And I have to say, Bruce enjoyed being at the Capitol and being a part of what was happening in legislature. That was a thing for him also.
Many would argue that Bruce had a full life with his family, successful practice, and ER work. Nevertheless, he still sought ways to challenge himself outside the office. It was important for his personal renewal to experience new challenges and adventures. So in 1979, he helped create the Columbus Track Club.
Shortly after I came to Columbus, I started running with a group. He finally did, I think, a Set in the Mile, which is the 20-mile run from Madison to Stoughton, and moved on from there to, I think, the Boston Marathon. He was a pretty good runner, too.
Bruce continued to train for marathons, attempted to summit Mount Rainier 3 times, traveled to the Galapagos Islands, and even to Russia for humanitarian work. His ambition to take risks and achieve goals in his personal life helped fuel his professional endeavors. As a rural doctor, he knew that access to healthcare services was sometimes a barrier to his patients, so he decided to meet people where they were at.
The mobile van was very unique to healthcare. That involved buying this beautiful blue, all customized. It was a customized van. It had seats and tables in the back. When we went on our mobile visits, Bruce would sit in the back, and frequently I would drive the van so that he could do his dictation for nursing homes. He was a leader. He was willing to serve on many committees and organizations that looked at improving healthcare and change.
Bruce has always been concerned about the direction of healthcare in his community. Over his 40-year career, Bruce served on more than 50 hospital boards and committees, the school board, and other leadership opportunities in Rio and Columbus. As his advocacy for healthcare in rural Wisconsin grew, so did his patients and the staff at his clinic.
I actually started working for Dr. Kraus as a fill-in. They needed some help during an evening clinic, and then just stayed. He had a belief in his staff and encouraged his staff to learn more, do more, and then you actually felt you could do more and learn more and accept the challenges that came across every day. We had patients who continued with Dr. Kraus's care for years at a time. And Dr. Kraus came in one day and said, as a thank you to his patients, he was going to celebrate his 25th anniversary here in Columbus. It was very heartwarming to see the turnout of the patients, because those are the ones who relied on him on a monthly, yearly basis.
When I schedule patients or reschedule patients, it's usually, okay, this person and him talk about the gardens, the farm. So we need to have at least a half hour with them. And then when it starts running into 45 minutes, I gotta knock on the door. And then he says, yes, can I help you? And then he still doesn't come out. A lot of our patients have been with him for as long as he's been here. And it's sad because when one of them passes away, it's like we're losing one of our family. I'm very proud to say I'm his nurse.
Dr. Kraus's career has been solely focused on dedicated service and intellectual growth for the betterment of his fellow man. His relentless drive to teach and mentor students shows not only his commitment to education, but also his aspirations for exceptional rural patient care.
Well, Dr. Kraus has always been very open to teaching others. He has been really a leader in this community and an advocate for this hospital and healthcare of this rural area. One thing that we all respect in Dr. Kraus is the way he cares for patients. I think that's why patients continue to see him 30, 40 years from when they first stepped in the door at his clinic. And that's something that I've tried to do in my own practice through modeling some of the way he interacted with me as a student. When Dr. Kraus sees a need in the community, he's ready to step up and help out with that. For example, our huge issue with drug abuse, he has one of the first in the community to take on the responsibility of taking care of these patients by prescribing Suboxone and treating those within our clinic.
Dr. Kraus's humble beginnings have remained with him throughout his life. A statesman in the truest sense of the word, it is rare to hear him speak of awards won, though there have been many in his 40-year career. He is simply thankful for his ability to help others.
I would say his top 3 qualities would be patience, understanding, and love of family.
Disciplined and dedicated. He's somebody that I can count on.
Caring.
Personable, professional. He's a good thing in one big package.
Dr. Kraus has a good sense of humor. He works here, he has to have.
I see him as my mentor, one of my best friends. I just appreciate all that he's done for me.
If he had a motto, it would be meet patients where they are.
That Willie Nelson song about On the Road Again, yeah, he really likes that.
The most valuable thing I've learned from Dr. Kraus is to set goals and to keep those goals and to be professional as you go along the journey of life to attain those goals.
He inspires me to be kind and compassionate and listen.
To establish those relationships with your patients.
How to gain trust from people and to good work ethics.
Continue contributing to healthcare and to be a part of the community.
I think if I could tell Bruce one thing, I would tell him how much I love him, how much I appreciate his capacity to do what he's done.
We are very proud to have Dr. Kraus as a long-standing member of Prairie Ridge Health.
Thank you for these 40 years.
He's the best boss ever.
I really appreciate you being my doctor. I love you and I respect you and I really appreciate you. Don't retire until I croak.